Hello and welcome to Local Edition. I'm Leslie Layton. Well, President Barack Obama admits that it's been a rocky rollout to the Affordable Care Act, but here in California, legislators, the state's still working feverishly to get California covered, moving ahead. With us now is Assemblywoman Sharon Quirk-Silva to talk about how that process is going and other things. Thank you so much for being here.
Yeah, good morning, Leslie. And yes, it has been a rocky road at the federal level, but here in California, we are leading the road here to enroll Californians into the Cover Cal, or some people call it Obamacare plan. At this point, we've also enrolled over 190,000 people. Many of those people, up to 80%, are actually in the exchange, not taking subsidies. Our office also has put on 4 constituent information nights with hundreds of people coming, very specific questions, and we're happy that we've been able to help them.
Well, there are a lot of questions people have, and admittedly, California did do a little better with its computer system than 6 people enrolling
exactly
nationally. But you still have to work with a lot of the information, the database that comes from the federal government, including the IRS, tax returns, because those returns are linked to what people are eligible for in terms of subsidies. So how can you, how can you work that all out?
As the federal system or website is improved, we're going to see more efficiencies. And again, like we said, we're not happy that it was so rocky, but as we get new information, our job in California is to make sure our constituents have it firsthand. We've been extremely high profile in the state as far as saying our office wants to be at the table with the grantees, with those that are giving information and even helping enroll. So just the last week in Buena Park, we had a 3-tiered session where we had people coming in for information, we had people going to another room to navigate the website, in a 3rd room to actually enroll. So I feel that although it's been rocky, it will pattern out and there will be some relief.
What is the breakdown as far as who is actually enrolling? Is it people who are the people who don't have insurance? Are they the young healthies, they say, that are really imperative to making this whole system work?
Well, I think it's a variety. One of the areas that we're most concerned about getting the information in would be the young healthies or the young invincibles, and those are your college-age students that haven't actually really looked at their own personal health. And so we've been out to college campuses. I was out at Cypress letting them know this is important, that they need to enroll, but we are going to have to continue to get that message out. So that's a group. Of course, we have the group that can qualify for Medi-Cal, looking at doing big awareness campaigns there. We see it on the media, radio, but we also know that we need to continue to get that message out.
It is definitely a program in flux.
Yes.
Changing the subject quickly, something that has started to move a little bit, the vehicle licensing fees. The county took a big gamble deciding they were going to keep about $150 million in vehicle licensing fees. The state said, wait a minute, no, you owe it to us, but you've been able to get some of the money back now from the state.
Exactly. Legislation that I authored, AB 701, was signed by the governor. We are thrilled. It was a bipartisan team effort that finally moved that long-term dispute between Orange County and the state of California to ensure that we are now on equity and parity with other counties. 58 out of 58 is not good enough. It will bring in $53 million to the county with room to grow. And again, it was a team effort, and I'm really proud of that legislation.
And so you have a payment plan instead of a bunch of cut programs moving forward.
Yes.
Thank you so much for being here.
Thank you so much for having me.
Assemblywoman, and thank you for joining us. I'm Leslie Layton.